Peter Walton is from Dendrite Solutions, a company that he started in 1993 already, figuring out that IT is going to be very important for the future of medicine, and he's actually going to tell us a success story of how IT has been used, not in a research, but in a hospital setting. And so we're very happy your presentation.
Good afternoon, ladies and gentlemen, distinguished guests, and Lord Brennan. And Lord, I have to say, I'm here to talk about a super system. But I'd like to thank the organisers for inviting me to talk. Before I start, I'd really like to thank Switzerland. Now, which is the... Here we go. Thank Switzerland and Roger Federer for a superb Wimbledon final. As many of you will know, there were somewhat mixed views in this country about the merits of a win by Andy Murray. And as Jeremy Clarkson pointed out, it was amazing how quickly Andy Murray changed from being British to Scottish when he lost. But anyway, best of luck with the Olympics. I think we need it too. A little bit of housekeeping. Yesterday I checked Transport for London, and it said that of the 270 tube stations, the one to avoid today is London Bridge Station. So congratulations to everybody for getting here. And if any of you are trying to get back to Kent, please note that the station is exit only between 6 and 10 o'clock this evening. Point of showing you this, though, is because you've all managed to get here, I don't feel too uncomfortable about talking about a semi-commercial story, because I'm hoping that none of you will listen to me or take much note of what I say anyway. So, before I tell you about an IT success story, let's just remind ourselves about some of the backdrop of IT failures. The most notable and the fastest expenditure of money was the Ariane rocket, where a 64-bit computer tried to tell a 12-bit computer something, and of course it didn't work. The backup system was exactly the same configuration, and they had to blow the rocket up at a cost of £4.5 billion. For those of you who were in the US in July 1990, AT&T, through a single code missing in one piece of software, stopped the whole of the AT&T phone system, and American Airlines reckon that lost them 200,000 reservations. And of course, the problem does extend to healthcare IT. Kaiser reckon they spent £4 billion on a system that didn't work properly, but I guess most embarrassing, and Lord Brennan's alluded to this already, we spent £12 billion on a system here, which is a staggering amount, which was then scrapped. And to put that into context, that's paying for 60,000 nurses for a decade. That's how much money was spent inappropriately. Okay, let's focus on success. I'm going to start with a story. It's a very personal story, so I hope you'll forgive me. And before I got involved, Sir Terence English, who was a very notable heart surgeon in the UK at Papworth Hospital, set up something called the cardiac register. He simply counted the number of cases that were being done across the UK, and this was the first of its kind. I know from personal stories that actually it was a very uncomfortable time being a heart surgeon in the late 80s and 90s. And in fact, at one point, 1 in 5 cardiac surgeons were suspended because of supposedly bad results. And the press coverage, and again, Lord Brennan talked about this, was unrelenting. The media took it out on the cardiac surgeons in a very big way. Now, a few years later, my collision course with cardiac surgery outcomes commenced. I was working as a junior doctor at the National Guard King Khalid Hospital in Jeddah in 1984, which had a cluster of VAX computers. And this was my first introduction to computing, and I was very impressed by what you could do. I then went on to London Business School and looked at the processes of how industry look at quality in industry and how this might be translated into healthcare. And I'm surprised to be saying this, but thank you to Margaret Thatcher, because she brought out a health white paper in 1987 that decreed that all doctors should track what they do. Now, this is the beginning of the process of improving quality. If you track what you do, you know where you are, and you can improve your results. So it was in the early 1990s that I commenced the Dendrite clinical systems story, and we started putting database software into heart surgery centres across the UK to track activity and outcomes. Our first customer was the Hammersmith Hospital, just along the road. In fact, we do also have customers at 6 cardiac centres in Switzerland, but the story goes back, if you go back to 1994, even though there was this push, only a quarter of centres knew what they were doing. And this comes down to the fact that doctors, when I grew up as a young doctor, you were taught to look at the patient in front of you and ignore everything else. The trouble is that also means you ignore what happens to your patients, you ignore the queue of patients coming to see you. And bringing in databases made people begin to think about what could be done in terms of managing their workflow. I was very lucky. I bumped into a young surgeon called Bruce Keogh at the Hammersmith, and together we set about the first data merge. So we took data from 10 hospitals and produced a report. The problem was nobody really wanted it. So I'd set up this system and this methodology. My responsibility, in fact, for the next 17 years was providing a data handling service for that society and also as a specialist publisher. So with some clever software in the middle, don't worry about that too much because the story is what it's all about. We created something called the Blue Books. And this was a 2-person effort in the early days. First one came out in 1996, the next in 1998, and wherever we went, we were castigated, vilified, and demonized. Even though, on both sides of the Atlantic, societies of cardiac surgery had recognized there were benefits in having a database. And in 1996, the British Society even set out a set of rules as to how this should work, but still nobody really wanted it. So people were collecting data, risk factor information and so on, but there was a huge resistance until the result of the Bristol Royal Infirmary inquiry. For those of you that don't know, back in 1997, there were some surgeons who had bad results. Unfortunately, the mortality rate for pediatric cardiac surgery was very high, and if you were a surgeon going to work in the morning, you had to walk past these cardboard coffins. So Ian Kennedy ended up producing an inquiry that led to a realization that actually you need to track what you do. So data collection became mandatory by law. But it was as if a tidal wave had hit the profession. It was a scary time. There was a desperate need to regain public confidence in heart surgery and heart surgeons, and a desperate need to put proper data into the public domain. So we continued with these blue books, the third one, 1999, the fourth in 2001, and we were still hated, castigated and demonized. Fortunately, we eventually got to the fifth book, which was the first time 100% of data capture across the UK, and we focused on things like survival rather than mortality. We focused on the good results. And we could even distinguish results between surgeons on a risk-adjusted basis. So these wiggly lines mean how is the surgeon doing against expectation. You could, of course, also identify outliers. So here is a surgeon who's done about 350 cases, 2 surgeons, with a mortality rate of just approaching 5%, and another with a mortality rate higher than that. All of a sudden, there was an overnight change. The book became regarded as a gold standard. Bruce Keogh was knighted and eventually became the NHS medical director. They made me, a lowly gynecologist, an honorary life member of the UK Society of Cardiac Surgeons, and this model has now been adopted even by the Chinese and the Saudi Arabians. So, all downhill from here. It's all about commitment to data. If you collect and analyze data, you have a fighting chance of improving quality. And this sixth blue book, and I brought one copy, which I'd be delighted to give to the first person who wants it. It's 500 pages of analysis, shows some remarkable things. In particular, the Hawthorne effect. This means that if you observe and track what you do, results will improve. And so despite the fact that the average age of the patients is climbing, and the number of patients over 85-year-olds went from virtually none in 1999 to over 500 in 2008, mortality was still falling. So what a change. Again, as Lord Brennan mentioned, this was now an opportunity for the heart surgeons to show how well they were doing. It was a boost for UK heart surgery. And in fact, the UK is outperforming many other countries around the world. And specifically, it's said that the reduction in mortality comes about because of data collection. So now we have very positive stories, and it even won an award. So here's Bruce Keogh and Leslie Hamilton picking up an award from the BMJ for a Best Quality Improvement Award for producing this book. All of a sudden, the database became a goldmine. Of course, at that point, the GMC recognized it was a good thing to do and recommended it as well. So there's now a new mantra. If you're a surgeon, you haven't finished your operation when you put in the last stitch. You finish the operation only when you put the data into the computer. So, close to the summing up, how do you make an IT project successful? And again, I'd like to follow Lord Brennan's comments. Keep it simple, have clear objectives, make sure you've got good engagement, strong leadership. And again, I was very lucky with Bruce Keogh, who was a very powerful and sensible speaker, who managed to convince a lot of people of the merits of this. And if you're lucky enough to read Sir Ranulph Fiennes' book on how to climb Everest and the Eiger, how do you do it? Somebody asked him. It's very simple. You put one foot in front of the other. And I'm conscious of the length of time it takes to do these sorts of projects. I was a student at Cambridge, at Keys, and when you start, you go through the left gate. That's the gate of humility, where you know nothing. As you're studying, you go backwards and forwards to the library through the gate of virtue, and eventually on the right, you get to go through the gate of honour. It all takes time. It's a long journey. And the cardiac surgery audit journey took, as you can see, 14 years. So where do we go from here? Well, the idea is to put real-time outcome benchmarking for any surgical procedure into the hands of any surgeon anywhere in the world. No longer big databases sitting in hospitals. You can now do it on an app. And so we're working with the Royal College of Surgeons on a global export idea, which will enable a surgeon anywhere in the world for any procedure to know how good they are. And very lastly, as Bruce Keogh says, after all, in my view, if you can't describe what you're doing and define how well you're doing it, you have no right to be doing it at all. Thank you very much.